sad is you have to turn the beep sound on. Look at me on my camera. Beep, beep, beep. Look how high tech.
Thomas is having surgery today and he's ill.
You really can't see it just looking at him, but see, that's going to tell you everything. Right now he's marking the actual outline of the cornea. Now he has to go through, that's kind of like a sponge. He has to go through and dry the eye. Because the laser can't treat in a wet area, it has to be dry. Okay, now he's going to do the scraping or the exfoliation. That's what he's doing right now of that superficial layer of the cornea. It'll start looking a little cloudy to us, which it does, you know, kind of. Yeah. You can kind of see the little cells. It's a little like in a little pile. It's just like dry skin. If you look down like towards the bottom of the screen, see the little cells kind of like in a little pile in there.
Yeah.
Yeah, that's what I'm gonna say.
Cool.
He's going into the military, right?
No, he changed his mind.
He changed, okay. See, he knows how far to go out as far as for the cells, what part of the eye he needs to treat. Feeling you that, because if he did, you'd hear him calling for you to come get him.
He's screaming, wasn't he?
Yeah, like, come get me now.
That's amazing.
His procedure will take a little bit longer because he has to manually do that when you want PRK. And like you notice, like some areas he's scraping a little bit longer. That's because he's getting it flat to the way he wants it, and more tissue may need to come off in that area. Just sloughing it off to the side there. And just took them off the cells so they're not in the way. He's buffing to make sure there are no extra cells there that he didn't lift off. It may darken the screen sometimes. Okay, he's treating the eye. See how it's dull?
Mm-hmm.
50% of it is done.
What's he doing there?
This is mitomycin. It's a type of antibiotic that they put on. It helps so there's no scarring, like scar tissue. And you did kind of make like a scalp, but you don't want to have like really bad scarring after that. So They do that, and it also acts as a buffer, so the eye's not really scratchy. Now they're rehydrating the eye. I'm gonna put the drops in. That's why you don't have to start the drops until tomorrow. And they use new vials on everybody, so. Miss Pat, there she is again with the drops. Squirting them in there, loading them up. That's the contact. It's like an actual contact lens. It's a bandage. You can see, scrape that layer off. And without that layer, that's what makes your eyes feel scratchy and because your lids are rough.
Mm-hmm.
So he has that buffer there again. Takes off the speculum. That's the drape that's around it. That's why it looks kind of funky like that. Saying okay. There you go. And you can get on this side.